Good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System. Delighted to be back with you on this beautiful spring morning, back from vacation from Colorado, trout fishing, all those wonderful things, and happy to be back with you today. We have a really fun program today where we're going to talk about some really new exciting therapies because today is a milestone on our campus as we welcome the arrival of a life-saving precious cargo coming to us from across the ocean. This is a video of the Megatron, and I don't mean the video game or anything. The Megatron, Gantry, and Cyclotron that is the heart of our Proton Therapy Center under construction on Rainbow Boulevard. The equipment traveled the ocean from Belgium, landed at a Houston port in February, where it sat until about 10 days ago. I suspect it did not travel by air. Our panel of experts today will explain why, despite a pandemic, the efforts to bring the first proton therapy to the region have continued and will also update the impact of COVID-19 on cancer diagnosis. This is a really special event, and I think the story of this is going to be really exciting. And we'll be talking to a couple of experts in just a moment. But first, Hawkeye, how are the numbers, man?
They're pretty good. I'm thankful. I'm glad that you're back.
Happy to be back.
Survived I-70 and in the winter, really.
The trip out across the pass, man. The road was closed right out eastbound, and we got through it westbound across Vail Pass. But man, on the way back, it was just sunny and warm.
Yeah, it's good for them to have snow. That's for sure.
Yeah.
And glad you got to recharge.
Yeah, I did.
Catch
Watch
some trout.
out. You guys are in trouble this week.
Our numbers have been good though since you've been gone. Really.
Yeah. Well, it's really I should go back on vacation. Done.
7 acute patients, 3 in the ICU,
That's awesome.
1 on the ventilator. We still have 15 in that recovery period, so 22. I think we were at 20 at some point within the last 24 hours, but I think, again, being closer to 20 than 30 is always much better. Hayes still has 1 active patient and none in that recovery phase. So
that's awesome. Some pretty big information coming out of the CDC yesterday. One, talking about the strength of Moderna and Pfizer vaccine in real-world data, cohorts of patients being followed who they were doing testing on weekly. They have found that indeed the shots do look like they are 99 to 95% protective in the real world and 80% protective after 1 shot, which is really important data, I think, especially 2 weeks after 1 shot. So that's really important. The second important piece of information that came out just yesterday was that the vaccines are incredibly effective at preventing disease transmission, meaning that once you've had the vaccine, not only do you tend to not get COVID, you tend not to transmit COVID, which is something we were hoping was true, but we didn't know was true. So I think that was really great to see.
Yeah, I think that's a wonderful thing. We were hoping from the early experience and from a couple small studies showing reduced viral load in that upper respiratory tract that we could reduce the transmission as well.
So big deal.
All good news so far.
The second thing was that surface transmission, again, looks less and less important. They're even pulling back on some of their recommendations for disinfection. Now, you still have to be careful if somebody who's COVID positive in your home, but all the fumigating, spraying stuff, probably not as important. So that's also good.
Yeah, and I think that feels good for us because I think, over the last few months we have talked about that, and you specifically said it's probably not as important as being in close proximity with someone, being at a fitness class or a restaurant where you're sitting with people from not your household and in that proximity. We still want to make sure that people are doing good hand hygiene, trying to avoid touching your hands into your eyes, your nose, or your mouth, frequently washing them or using alcohol gel. But I think that's also other good news for businesses. We know that a lot of businesses have tried to go over and above, showing how they're doing disinfecting and cleaning measures, when if you just do routine cleaning for the most part, soap and water or other commercially available detergents, and cleaning that on a regular basis, in general for your customers and your clients, that's going to be a good enough job to really decrease the amount of spread anyways.
Yeah, well, that is really important, and I think that doesn't mean you don't wear a mask. You still should wear a mask, especially because we're seeing the variant rise in many states. Not really as here as yet, but I suspect it will get here. And for those who are, by the way, on the data the CDC released yesterday, that Pfizer and Moderna vaccines look incredibly effective against the variants, all of the variants. That's also great news. But I think that the risk of the variant, though, is still that, and we're seeing it in some states, that's where the rise in cases is. So you got to keep masks on for now. Although I think, man, if we can get 70 to 80% of people vaccinated, it is a different story at that point.
Well, I think the masks are important just because if you are having your mask on, again, it is a good barrier, so you're expressing less virus and droplets into the environment and onto those surfaces anyway. So again, it is all that Swiss cheese model. It's not one particular thing, but it's a number of different practices that help to reduce transmission.
And just to say, I have not missed having influenza. I'm one of those guys who kind of gets influenza a lot, so I have not missed not having influenza this year. Nor cold. I mean, it's been great.
That's good.
So, all right, well, let's talk a little bit about this Megatron cyclotron deal, because that's a pretty important thing here to the Kansas City region. We want to start with a story from George Langston, and then we're going to jump into some reporter questions. Can we key up that story from about George Langston, the patient story? Let's hear that.
George Langston is a fun-loving 7-year-old who likes to ride his bike, play soccer, and is even brave enough to try a skateboard. But that bravery was tested last year when he and his parents noticed something strange under his left eye.
It was a little bump. It started as a little bump.
At first, the family doctor thought the bump was just from wrestling with his older brother and sister. But that bump kept getting larger till it eventually interfered with George's vision. After many doctors, tests, and even surgery, the mass under his eye was diagnosed as cancer. George started chemotherapy, but the nearest available proton beam therapy machine was at Mayo Clinic in Minnesota. Just as they were preparing for the 425-mile trip from Olathe, with Mom and Dad alternating weeks,
thank you all for the sacrifices you've made in recent weeks.
The pandemic stay-at-home orders came out. It was a blessing in disguise, since now the whole family could go, including their 3 pets. They settled into a rental home minutes from the facility, while the older kids continued school online, and Justin kept tabs on his business remotely.
Not have to worry about going to work, so it really worked out well for us to all be together.
After 50 days of treatment, the big day finally came. George's treatment was done. And he came home to a hero's welcome from family, friends, and neighbors. George was able to start school in September, and while his journey with cancer is not complete, all signs are positive.
Yeah, what would you tell another little boy or a little girl? Be brave. Be brave.
Yeah.
Langstons believe proton therapy is a game changer for cancer patients in the metro and surrounding region.
I am so happy that it's here for people that aren't able to pick up and move across the country. It's an amazing technology.
Wow, that is really cool stuff. So proton therapy is a type of precision radiation that protects healthy tissue around cancer tumors in a way that conventional radiation therapy cannot do. When you've got cancers in the brain, around other vital organs, you're a little person. Tissue-sparing radiation becomes more critical. Both were the case for 7-year-old George Langston from Olathe. Today, we welcome 2 really great experts, Dr. Terry Sue, our VP of Clinical Services and Physician-in-Chief at the University of Kansas Cancer Center, and Dr. Ronnie Rotondo, Medical Director of Proton Therapy Center here on the campus. We're going to talk a little bit with these 2 great folks, and then we're going to take some reporter questions, and then we'll jump back to you guys. So first of all, Dr. Rotondo, George is your patient. How is that little guy doing? Why did you make the decision to send him out of state for proton therapy?
So he's actually doing very well. He completed his chemotherapy after radiation last summer. All of his radiation effects have resolved other than a little bit of dry eye. And he's thankfully doing well, back to his regular activity at school. The decision was certainly not taken lightly. Of course, as you highlight, in the midst of a pandemic and all the concern about traveling out of state. But in his case, he had an aggressive form of sarcoma, soft tissue sarcoma called a rhabdomyosarcoma, which are more commonly seen in kids. And his was an orbital rhabdomyosarcoma rising just adjacent to his eye. Over the last 56 years, we've made tremendous progress in pediatric treatment of pediatric malignancies and significant improvement in prognosis outcome. But nevertheless, there's still a significant risk in terms of long-term effects of treatment, and radiation is one of the primary culprits. And with conventional radiation, unfortunately, although still quite effective against the tumor, you oftentimes have a lot of excess radiation to normal healthy tissues and organs adjacent to the area you want to treat. And in this case, there's the brain, his pituitary gland.
And those are important things, that brain thing. That's important.
Absolutely.
Yeah.
Especially in a young child. So kids are particularly sensitive to the long-term effects of radiation. And, radiation to the brain can have significant impacts in terms of neurocognitive impairment. So issues with short-term memory, concentration, IQ. So that can really impact their academic performance and have a significant impact in their life.
Yeah.
But there's also, other important structures, like I mentioned, the pituitary gland that produces a lot of important hormones, like growth hormone, hormones for fertility. And with proton therapy, unlike conventional radiation, we can better focus or target the radiation. We can control the depth at which the radiation travels so that we can minimize or decrease the excess radiation to normal healthy tissues. And therefore, we hope that may decrease the risk of long-term effects. In his case, through my experience coming from Florida, where I was treating kids with proton therapy, I knew that in his case we could really potentially have a significant impact by minimizing radiation to the brain, to the pituitary gland, and really limiting the radiation to his orbit. And so through discussion with his parents and family, I made that strong recommendation to pursue proton therapy, because I strongly believe that it was the best treatment for him to maximize the chance of controlling tumor, but at the same time minimizing the risk of long-term effects.
So, and he's doing well.
He's doing great now. He's certainly got still a long road ahead in terms of long-term follow-up, but clinically he's doing great. So we
all right. And so George Langston, if you're listening, I just want to say to you, I saw your T-shirt. It said Star Wars. I may be a Trekkie. I love Star Wars too. May the Force be with you. All right. So let's. This is a video right now that we're seeing from a drone that's following our cyclotron Megatron out there. One of our reporters is out there running that. So that's a great. You can see on the truck what it looks like. It's pretty heavy. We're going to talk more about that in just a moment. But Dr. Sue, some have said we're in a proton therapy desert here in the Midwest, which you can plainly see when we show the map of proton centers. You're a head and neck surgeon, and you're the physician director of the entire cancer program. How will this center benefit under the proton therapy program here, and how big is the need in general for this?
Certainly. Well, the need is increasing. We're learning more and more about that technology every day, and part of the important aspects of having Dr. Rotondo lead the Proton Therapy Center is because his involvement in learning about this technology and its ever-increasing utilization in different types of cancers. So we're learning every day on that, and that'll accelerate once the proton machine is here, and it's sitting right outside of the hospital as we speak in the next few hours. So it's a very exciting time for us. But certainly we are in a big donut hole of the country where there isn't this technology available. And as you saw from the last story, this family had to pick up everything and move for about 2 months away from their home, their family, their friends, and their support network to really obtain this therapy. That won't be necessary anymore in less than a year's time. And that's something that's been very, very near and dear to me in the cancer center, because we know patients do a lot better when they get treatment close to home, and they can get the best treatment close to home with all the support network around them.
Yeah, and I understand that this is getting really close, right? So this is a live video or live shot from a drone of the cyclotron and the Megatron, and as I understand it, this is really close to where it's supposed to be, right? It's getting really close to Kansas City. Is that right, guys?
It's in Kansas City.
And when's the delivery date supposed to be? When's it supposed to get here?
So it's currently Kansas City, and we're going to be dropping it in the vault, in the cyclotron vault.
Okay.
In the gantry vault.
Okay, and it's a 75-ton gantry, which I might want to point out is just slightly bigger than my Toyota Sequoia from 2003 to 200,000 miles on it, and a 55-ton cyclotron, which is still bigger than my Toyota Sequoia. So this is really big.
Yeah.
In layman's terms, how does that work together to provide a proton beam, Ronnie Rotundo?
Sure. I mean, it's really impressive to see, and so I really hope a lot of people are watching or come out to see it. And combined, it weighs, like the weight of a 747. So it's really impressive.
Wait, the weight of a 747.
Wow. So so the way it works in simple terms, essentially the protons are derived from the hydrolysis or breakdown of water. And then we extract the proton from the hydrogen.
Wow.
That's introduced into the cyclotron. And through electromagnetic fields, those protons are energized and are accelerated in a circular fashion in the cyclotron to 2/3 the speed of light. And that happens within fractions of a second. So then that exits, the energized proton beam exits the cyclotron, goes through this energy selection system that allows us to control the energy and so that the depth to which the protons travel. And then they're steered with electromagnets into the gantry. The gantry is a structure that requires about 3 stories clearance to rotate about the treatment table around the patient to allow different beam angles.
Wow.
And then the protons are funneled to the nozzle where the protons or radiation come out and are delivered to the patient.
Wow, the whole thing it's kind of science fiction-y.
So, kind of to play off Dr. Sue's comments, do you envision this eventually taking the place of standard radiation that we're familiar with for all types of?
Right, so that's a great question, an important question. So I think that there are many patients that stand to benefit from proton therapy, but not necessarily all patients. And so I think there'll always be a role for photon therapy, but I think there's an ever-growing role for proton therapy. And that's why at the institution it's important for academic centers such as us to participate in those efforts to better characterize, the potential benefits and, characterize which patients can benefit the most, which patients don't benefit, to make sure the ones that do get it.
As I understand, and looking at some of the information we received, is that it takes like 4 hours or something to lower this equipment into the thing, and it's got like an inch of clearance on each side. Is that right?
That's right.
Okay, that's a long way, man. Now you have to sit there. Are you going to go watch this happen, Ronnie? Are you going to? Do you have a bleacher seat, or are you have a front row seat? What do you got here?
Unfortunately, I have some patients to see, so I can't stay the whole 4 hours. But
really, are you selling tickets? Okay, people come. It's a pretty big.
Yeah.
It's pretty impressive, the accuracy, and again, to think of the sheer size and weight of these components, and again, just to think about the gantry, again, is a huge 75-ton structure that rotates with millimeter or sub-millimeter accuracy.
So basically, you're lowering a
impressive.
747 into this hole in the ground with an inch to spare on every side, and it has to be a perfect landing. Impressive. Okay. And you're not driving it, though.
No.
And you're not going to be able to watch it, because I'm taking beer and popcorn in a seat, and I have to have a big hat, because I don't want to be your patient. But, all right, that is great stuff. So what, with the proton therapy as part of the NCI Center grant, what kind of research do you all think we're going to be doing with that?
So I think, there's a lot of opportunity. Not only does obtaining a proton facility increase or add to our armamentarium or modalities that we can offer patients in order to make sure that we offer the best individualized care. But there's a lot of areas that are ripe for research in proton therapy. One of the big things, as I mentioned, is better characterizing which patients benefit and which don't. And potential opportunities in terms of expanding indications. There may be some opportunities where with proton therapy, because we're able to deliver the radiation in a much more focused, precise manner, perhaps deliver higher doses of radiation than was perhaps possible before, and improve outcomes. And certainly areas where we can potentially decrease long-term effects by decreasing radiation to normal-healthy tissue. My personal interest is, of course, in pediatrics and young adults, and how we can leverage these dosimetric advantages to improve outcomes and, importantly, decrease long-term effects of treatment for these long-term survivors.
Yeah, that's a big deal.
Yep.
All right, so let's switch gears just a little bit. Terry Sue, the impact of COVID on cancer patients. Man, that's still an unfolding story, and I don't think it looks like a good story.
Certainly, it's been a pretty significant impact, and we're seeing some of the ramifications of that now as patients are presenting at a little bit later stage than they would have if they had maintained their normal health care and prevention throughout this last year of the pandemic. There's been recent estimates between 9 to 10 million of the 3 most common cancer patients have declined on screening, have delayed their screening. So you can imagine if there's about a 1 to 2% catch rate on the cancers being caught early in these screening exams, that's a pretty significant number of patients across the entire nation that we would have caught in this last year at a much earlier stage. But because of the lack of and the inability to get screening, there was a time when mammography units were all closed down and no one can get their screening breast mammograms. And so we're really going to see that impact. I think we're going to see that impact over the next few years with an increase of incidence because there was a decrease in incidence due to patients not presenting during the year of the pandemic, but also patients presenting at more advanced stage. The other thing I'm worried about is patients aren't getting their vaccines. There are 2 cancer vaccines. The hepatitis B vaccine prevents liver cancer, and the human papillomavirus vaccine is very, very effective against certain female cancers and ever-growing problem with throat cancers. And patients aren't getting their vaccines. That also was put by the wayside. And so that will have an impact several years down the line when the patients then develop these cancers. So please get back on the schedule of your vaccinations, get back on your schedule with your screening mammograms, your colonoscopies, and your prostate screening exams, your lung cancer screening exams, because they're so important to catch those diseases very early.
Yeah, boy, is that just the... Go ahead.
Yeah. I mean, I emphatically endorse that message from Dr. Sue. You know, obviously for hepatitis B and A, that vaccine, as he was talking about, but more importantly, for our children and our young people, we know the efficacy of the HPV vaccine and what it does to protect young boys and girls from later on developing those types of cancers that can be so devastating. So please, parents, get out and get your children vaccinated, or even young adults can still have that ability to get the HPV vaccine as well.
Yeah, and again, as a cancer patient myself with prostate cancer, and with the family history, early screening, getting into the right treatment after that folks, that is just so important. Don't squander your chance at successful therapy because you're afraid of COVID. Wrong idea. Hospitals and offices are incredibly safe. Get your vaccine. That will also incredibly keep you safe. And as it's all opening up, we're going to have a lot of vaccine over the next few weeks, and just encourage you to do that. But don't drop the ball. You know, we've said before, here we are. We're down at the goal line. Don't fumble on the vaccine, and don't fumble on your own health, because those two things really really go together. Hey, Jess, let's first see, because I forgot to ask earlier, it's my post-vacation stupor here, but if there were any reporter questions out there.
We do. Ray Daniel with 41 Action News has a question on behalf of one of their viewers who is 14 weeks along. With the new variants, she has been a little hesitant about getting the vaccine. She is going to get it, just debating on if it's too early. What's your advice for expectant mothers on getting the vaccine as we get more information about the other variants?
Yeah, so, and Hawkeye, I'm just going to say, just again, based upon all the weight of the accumulation of evidence, and especially what the CDC released yesterday, vaccines look effective against the variants. I would say go get it, but what are your thoughts?
Yeah, I would definitely say go get it. You know, we know that mom can transfer some of her immunity to baby for other types of diseases and infections. We now have a little bit of evidence coming out suggesting that people who are vaccinated, mothers who are vaccinated, are actually able to transfer some of those antibodies to baby as well. So I think if you are offered the vaccine during pregnancy, get it. We still know that the obstetrics societies, medical societies, still recommend that if you are a mother and you are offered, you can talk to your physician about it, but their main stance is that if you are offered, you should go ahead and get it.
And I'll just say, remember that the variants are not a reason
Right.
to not get the vaccine. They're actually an important reason in addition to go get the vaccine.
Yeah.
It's actually should add to your desire to get it, not detract.
And we do have real world and basic science research showing and suggesting that you do continue to have efficacy against the variants so
And
far.
Ronnie Rotondo, I'm just going to bet you would tell every cancer patient, go get the vaccine.
Absolutely, I tell all
Yeah.
of them. And I'd just like to just comment on what we were mentioning
Please.
before. And in many ways, it's kind of counterintuitive maybe for the public, but in many ways, I feel safer today than ever before for my patients to come visit and for their clinical exams or investigations with all of the sanitation and disinfection procedures,
masking, it's huge.
masking, PPE, everything.
Yeah.
In many ways, especially for patients on chemotherapy, bone marrow transplant, I think it's probably never been safer. And so I really encourage
I bet it's
everyone
not going
to
to go away. I think
Right.
we're going to keep, I think especially for like a BMT patient clinic, no, y'all ought to just be wearing masks all the time because the influenza story,
Yeah.
how many influenza cases have we had at KU this year?
None that we know
None.
of. Yeah.
That's an incredible statistic. Infection control works.
Ready for community questions?
Yes, ma'am, unless there's another reporter question. Should we pause and listen? Okay.
Okay, so Isaac says he read something about 10 years ago describing how proton therapy was declared a failure. Is that true? If it's true, what has changed since then?
Well, it better not be true.
Right.
We're going to block traffic on Rainbow beginning either. What time is it today, Terry? Is it today or tomorrow to get these things installed?
Yeah, no, actually, they're dropping in the counterweight probably as we speak. I was just out there right before this interview, and the counterweight for the gantry, it looks like a big Hershey Kiss. I'm not sure how many tons. Jeff Wright and I were trying to figure out how many tons it was, but it's being dropped in right now, and the other unit will be here in a couple hours. So there's a whole caravan of trucks coming with police escort. They actually have to bring their own power machines and personnel because sometimes they have to move structures above the road out of the way so the truck can get by. It's a pretty impressive caravan, and we'll be seeing some live pictures of that.
Yeah, cool. Can't wait to see that. Love seeing the drone of the gantry and the cyclotron in there. So, okay, Jess, question?
Okay, so if this is precision radiation and tissue sparing, why not use this for all cancers?
Dr. Rotondo.
That's a great question.
Sorry, go ahead.
So I think it depends on a number of factors, including the stage. So in order to benefit, if you're using proton therapy to spare or limit radiation from healthy tissue, the stage impacts the likelihood of those benefits manifesting, and in some cases, even though the treatment may look advantageous on paper on our treatment planning systems, it may not necessarily have significant or measurable long-term clinical outcome. And so that's why I think it's important. There are some situations where I think that there's significant growing data that supports proton therapy, but for some other patients, I think the benefit could be limited. And so I think there's a lot more research that needs to be done to better identify which patients can benefit.
So, Dr. Sui, as a head and neck surgeon, are there patients that you have that you think would benefit from proton therapy?
Absolutely. The head and neck has some of the most complex anatomy around where these cancers originate. And so we're very, very excited to have this technology. It's, in fact, when proton therapy came out, the prostate was the most common site, but now the head and neck is rapidly overtaking in terms of its indication in the area, because you can imagine the brain, the spinal cord, the eye, a lot of important nerves and other vasculature structures are in that area that need to be spared the ravages of some of the standard radiation therapy. So it's important to go to a place where you can have the technology and all the various treatment options available to you. And so it's a very exciting time for us, especially in the head and neck. But as Dr. Rotondo said, we're learning about more and more different areas: breast, lung, pancreas, spinal cord tumors, tumors at the skull base. All those have a very, very important structures that are very in close proximity that need millimeters of precision in delivery of that therapy, and that can make the difference between some significant long-term effects a few years down the line and several years down the line. Patients are living a lot longer with cancer, which is phenomenal. One of our biggest accomplishments, but a lot of times that they suffer the consequences of that curative therapy. This is a technology, in response to that other question about its indications and its utilization, that we're understanding a lot more that can spare those side effects down the line. And that's why this is so important to have in our toolbox here at the University of Kansas Cancer Center.
And Terry, I remember you and Jeff presenting this to our senior team, and you know, there was some evidence. People were like, "Oh, proton therapy is a failure. It's not really important." Man, that story feels like it's flipped on its head here in the last few years. Talk to us a little bit about that, both you and Dr. Rotondo.
Yes, I think one thing there certainly years ago and still today some controversy in terms of the expense of the capital expense of the treatment and the cost, but one thing to keep in mind is that a lot of this data takes time to generate. And to mature and to demonstrate those benefits. And Dr. Sue was talking about hidden cancer, and what's so exciting is that we're starting and increasingly seeing day by day data published showing those clinical benefits. So we've known for a long time that dosimetrically, so if you compare the distribution of radiation, and you look at it pictorially, you can see a difference. But now we're actually seeing those clinical benefits materialize. So in the head and neck patients, decreased oral mucositis and pain and requirement for pain medications, data showing less need for feeding tubes. There's data looking at patients who have had, required concurrent chemoradiation and comparing photon therapy and proton therapy, where they actually showed decreased acute toxicity, decreased toxicities, also decreased hospitalizations. So that argument is reversing, where some of the criticism about the cost and so forth. There's actually a lot of potential to decrease overall cost by decreasing complication rates, decreasing hospitalizations, decreasing recurrence
rates. It's not
rates.
just how long you live, it's how well you live.
Yeah.
And clearly people are living better after proton than just routine radiation.
Absolutely. There's a quality of life perspective. When we were talking about pediatrics and kids, and data that's now showing a decrease in terms of the impact on neurocognitive effects. So young kids with brain tumors being treated with proton therapy, having a better preservation of their neurocognitive function. That benefit is immeasurable for those kids as they grow and go through school and work and the impact on their life. So, I'm very optimistic. I think, there's growing data every day suggesting that, there are benefits. But again, I think, as an academic center, it's important that we ask those questions and we continue to play an important role in expanding that, the knowledge in terms of best indications, patients that may benefit the most. So make sure those that can benefit get it.
And so go ahead.
Yeah, I was going to say hopefully less infection in those devitalized tissues from the traditional radiation too then.
So one other question on that young man we spoke about earlier this morning. How's his vision in his eye?
So his vision actually pretty good, preserved. He's certainly again, early on post-treatment. And so some of these effects, take years to manifest. And so he, with proton therapy, particularly if it struck, tumors immediately adjacent or involving, immediately adjacent to a critical organ, that sometimes you're still going to have some dose to that. So there's always still some risk of vision effects, but with proton therapy, because we can really focus and limit that radiation,
so
we anticipate being potentially less than with X-rays.
Right.
But currently
so
he's
external
doing
beam radiation, would his eye have been able to be preserved?
So there would probably be a potentially higher risk of impacting his vision long term.
So right there, I mean, that's just so important. Jess, let's see what other questions we have.
How big is the need for proton therapy, and is it covered by insurance?
Okay, Dr. Rotondo.
Another great question. So, again, I think that the need is significant. Again, not all patients will benefit, but probably a significant number of patients. There's different estimates, but some say 20%, 30% of patients that cancer patients that may benefit. And the insurance coverage, varies from insurance provider to insurance provider. So there are some indications which are more generally recognized and that they're more willing to authorize for proton therapy. And there are, but even if the indication is not covered, there's always a possibility to make a clinical case for why proton therapy would benefit that patient. And so there are some mechanisms where you can make that case to the insurance company, and there's many opportunities where that protons ultimately gets approved.
Yeah, very cool. And Dr. Sue, you've been involved in the fight to get proton therapy here, as we said earlier, and to help get it approved. Thoughts that you have on the journey you guys have made?
Well, it's really a milestone. Today is a great milestone to actually see that physical unit being dropped, like you said, with a 1-inch 747 being dropped into the vault. Just to Dr. Rotondo's point is this is a single gantry system. This is really the wave of proton is moving down to these smaller units. Some of the bad reputation in proton financially was based on these multi-gantry units. Will be one of 38, only 38 centers in the United States by the time this unit opens and is treating patients. And so very, very few select. And all those 38 proton units are not equivalent. All of them don't provide pencil beam scanning or this very, very, very precise type of delivering of the proton beam. And so that's a subset of those 38. And again, at the Cancer Center and as a leader in the Cancer Center, we don't consider this as the ultimate hammer. This is just one of many, many tools to really develop that individualized plan. And we're learning more about these tools as well in their indications. In fact, some types of radiation help the delivery of chemotherapy to the tumor. And so we're learning about how these therapies are interacting together and helping each other to produce a better outcome than they could individually.
So if you're interested, this is about a mile west of I-435. So it is that close, people.
Wow. Kitty asked, does this proton therapy work for brain cancer patients, and how will it work?
Dr. Rotondo.
Yes, so brain tumors are can be potentially a good indication for proton therapy. Again, depending on the brain tumors encompass a large variety of different types, and so it's important to be specific in terms of making that determination for each case. But again, with a lot of critical structures in the brain, and our interest to kind of spare those and try to minimize long-term effects. Proton therapy could be an important treatment modality for brain tumors.
Okay, Jess.
Okay, so John Paul asks, are the numbers rising in states who have not been efficient in getting vaccines into arms? It seems like Missouri and Kansas are doing great.
What do you think, Hawkeye?
Yeah, I think there's a combination. Ever since the vaccine rollout started, we heard how low Kansas and Missouri were, how other states were doing much better. I think, again, it continues to go to those local community infection dynamics and a lot of behavioral issues. Also, and what we mean by behavioral issues is people going out unmasked and meeting in large groups, things of that nature. But also what is the prevalence or the amount of any one particular variant in that area. I know that the UK variant is really being implicated in the Michigan rising. Still, we know how the disease is spread. We know how we can protect ourselves from it. That's masking, distancing, not meeting in large groups. I think the vaccine component is one component of that. Certainly for our most at-risk patients in the nursing home, we saw that the vaccinations had a large impact. Now, as we're moving it out into more of the general population, mass population, we'll see how that affected. But it's hard to say it's one thing or the other. I think it's a combination.
Yeah, that was my sense. It wasn't just one thing. And also just a comment. I think that Missouri, and I know Kansas especially, part of this has just been getting the data. We've given more shots than the data reflects,
Yep.
and we just, that's always a hard one to say because it's hard to explain. Why is that? Well, it's just because of why it takes a while to upload the data in some states and because of the system we use, and really I think in most places. And so it just takes a little while, and as that data comes up, we'll see our numbers get better. And that's just kind of a that's just a glitch, if you will. But I think that the point about the variant is right. I mean, if you just good infection control practices, get vaccinated, wear your mask until we can say, gosh, a lot of people have been vaccinated, we're really good, then I think we'll see it. I think we'll see a better situation. But if people are out there, and the variant spreads, and sort of, you think about it in concentric circles. So if there's an outbreak of the variant, it just takes a while for that. Think about if you dropped a rock in a pond and you watch the waves spread out. You find these epicenters of where the variant is. It takes it a while to spread out, but it's going to come here. And so you just have to be prepared, and you have to protect yourself. The way you protect yourself is, keep your distance, wash your hands, wear your mask, and get your vaccine.
Amanda wants to know, when they talk about durability of the vaccine time frame, are they talking about from your very first shot or the day after the 2 weeks after you've got your second shot?
Yeah, I'm not really sure about that point. I think it's probably more after the 2 weeks after your second shot.
Yep.
That's
what it is. Yep.
And it's like, how long will it last then? And I think the evidence is still pretty good that 8 months you have fairly high levels, at least of antibodies after the shot. So I don't know. We ought to be hitting some data that's out there for a year now, and we ought to be seeing that reported pretty soon.
Yeah, I mean, we've seen from natural infections, from some basic science research, that you continue to have some T cell responses, although not as great as the antibody levels at more than 6 months. But that's for natural infection. And I think we have shown and we have seen that vaccination, if we use the proxy of antibody levels, vaccination has improved the immune response compared to natural infection, meaning they have seen higher levels of antibody in those patients that have gotten vaccinated versus those people that may have had mild or moderate disease itself. So the vaccination, I think, is showing to continue to be more important than natural infection in providing immunity, especially longer lasting immunity.
Okay.
Susan says radiation can cause cancer. So does this lessen that risk?
Yes, I mean, that's certainly one of the potential significant benefits of proton therapy. So radiation can cause a secondary tumor. And that's in part related to the overall radiation dose to the body. And with proton therapy, because we can deliver the radiation in a much more targeted, focused manner, and significantly decreasing the amount of excess radiation to normal healthy tissue, there's data that suggests we can potentially significantly decrease that risk by as much as a half, or in some cases 2/3. So that's certainly a potential benefit in some patients.
That's a big deal. I like that data.
Okay. Kitty wants to know, what is the time frame for proton therapy to be up and running at KU, and when will you start seeing patients?
All right.
So we're hoping to treat our first patient in early 2022, so roughly a year, just under a year from now. And we'll likely start to see patients consultation at the end of this year, December.
Coming up soon, isn't it?
Yeah.
So, Dr. Stewart, that's like a dream to you come true, right? That's a big deal. Are you gonna, or do you have a front row view of the lowering of the gantry and the cyclotron at all?
I'm on quick text, so I can run out there and see it when it's good. It has been a long time, and it's been a journey. One thing I want to add on in terms of the utilization, we've really not emphasized this, but really it has a large role in recurrent cancers as well. The body, and as the previous viewer mentioned, there is some damaging tissue that can cause cancer in normal tissues and or damage in normal tissues. And so once they've had therapy in a particular cancer, and if that cancer were to recur in that area, it's even more important to have very focused, precise therapy that decreases the amount of even additional radiation to the normal structures around the area of the recurrent cancer. And so that's a whole other area that this technology is going to be very, very crucial and really add to our toolbox and armamentarium in fighting these very difficult recurrences.
Yeah. man, this is just the best stuff. Hey, tomorrow, pulmonologist, critical care, and sleep specialist Dr. Nancy Stewart is back with her update around sleep during a pandemic. We had a lot of questions last time she was on. Everyone know more about sleep medicine, so we've asked her to come back. That'll be great. And weather permitting, the gantry and cyclotron are going to be lowered over the next 2 days. They'll be hoisted from the flatbed truck and carefully put into the pit. We mentioned before it only has an inch around it. It takes about 5 minutes to hoist it into the air and 4 hours or more to lower each part of it into its final resting place. Quite the spectacle. Reroute traffic along Rainbow. Be careful when you come that way. Dr. Sue is going to text me when he goes out there because I want to come see this thing happen. I know Dr. Rotondo is going to be out there. He's not admitting that he does have a front row seat plan and already is trying to sell tickets out there.
You'll bring
guys,
popcorn.
Yeah, watch out. So, Dr. Sue, final thoughts today.
Well, again, like we emphasized earlier, take care of yourself, and we're seeing a lot of people neglecting themselves. Everyone, it's a new normal, but the mainstay, the constant normal is please take care of yourself. Get your screening. Take care of yourself. Get in front of any problems that you have.
All right, thank you, and thanks for being on our program today. Welcome back anytime, Dr. Rotondo.
Thank you.
Final thoughts.
Well, I just, again, like I said, it's an incredibly exciting moment for us, our health system, and the city and the state. And, first thing, I just want to, I'm thankful and grateful for the support from the health system leadership, and as well, our partners in this project and the community support for this. As we mentioned before, we hope to start treating in just under a year. Proton therapy is coming right here in Kansas City, and I think it's just important to, if either you have a cancer diagnosis or a loved one has a cancer diagnosis, to inquire and see if maybe proton therapy might be a good option for you.
Yeah. All right, Hawk.
Yeah, I'd just like to echo what Dr. Sue said. Take care of yourself and your loved ones. Make sure you're making those screening or routine physical visits. Make sure you're getting those vaccine appointments. Either, they're so available now, walking into private pharmacies or talking with your medical team. Get those vaccinations for you and your loved ones to help prevent issues or diseases that can otherwise be preventable, so you don't have to be dealing with those down the road.
Yeah, don't work so hard at staying safe that you don't get your cancer care, because you see, that's not the right idea, because hospitals and clinics are safe. I know these guys from the Cancer Center. I want to say a special thank you to Dr. Rotondo, a special thank you to Terry Sue, Dr. Sue, because these guys have worked so hard. This is a really big deal. It's a big deal for our region. We want you to be here to have it. Plus, let's be honest, there is Star Trek Discovery Season 4 that's coming out next year, and the teaser's out, and it just looks so awesome. It looks so awesome. So we've got, and so yeah, I'm back. I'm going to be talking about Star Trek and Star Wars. Anyway, listen, thanks to everybody for tuning in today. Be with us tomorrow when we hear from Dr. Nancy Stewart, and follow the advice of these great physicians. There are so many exciting things that are happening in medicine, and clearly proton therapy is one of those really exciting things. We want you to stay healthy. We want you to stay safe. And so remember, there's still no place like home. We'll see you tomorrow.